In this webinar, we're going to talk about bloat, which is a horrible disease for large breed dogs. I'm Dr. Jeff Brogman from the ACE Academy for Canine Educators. In this webinar, we're going to talk about bloat, which is a horrible disease for large breed dogs. And it's something you should know about so that we can prevent problems and deaths. Now, the thing that we want to show you first off is what's the definitions here. Now, the big disease that we're talking about is gastric dilatation bulbulus. Now, what that means is gastric is stomach, of course. Dilatation means that it dilates, it gets bigger. And then, as it gets bigger, then it could twist on its axis. Now, this is a picture of the stomach. Food goes in here, and then stuff leaves the stomach here. Now, think of this like a sausage, as in if you're making sausages and getting those little links to, as in, well, how it happens is it just turns and then it cuts off so it forms the next sausage. Same thing happens here. The place that the kinks happen are there and there. So you get this whole part and just twist it, and it can be a 180-degree turn or a full 360. And so what happens is that the stuff that's in there, of course, can't exit or enter, and therefore it's now stuck. Now the volvulus means that is that torsion. Now the thing is, most people regard this whole thing as bloat. And that's okay, we can call it that name. But the thing is, bloat by definition just means swelling of the stomach, not necessarily the twisting. So let's talk about bloat in that whole disease context. When this occurs, what's happening is that we're getting a swelling of the stomach with air. Now what we don't know is, does that air collect after the stomach is twisted, or does it collect before and cause the twist? And even when I went through vet school, way back in the dark ages, what we talked about then was that, well, yeah, there's methane in there, so it must be from the food that's in there being fermented and producing this gas. And then the next thing we were told is, no, it's from swallowing air because the stomach's got a little, say, an upset or something. And we do see this. If a dog's got an upset stomach, or if they're in pain somewhere else, they will swallow air. And if you take an x-ray, you see the air in the stomach. And so we still don't know where that comes from. What we do know is that when a torsion occurs, the air is stuck in there and it can't come out. And that's the key. This is how this disease really causes its problems. So what we have is a swelling stomach, and what that does is it puts pressure, obviously, in the belly. Now, if you were to look over these dogs while they're standing and have a feel at them, and that is go down the ribs and then just feel the abdomen, you'd actually feel sort of I call it a soft, doughy swelling. It gets harder over time, but it's just there. It's air, of course. And then behind that, the abdomen goes in. Okay, so what's happening there is that the stomach's swelling, and it's putting pressure, number one, up above it, and that's where all the veins are that drain the back end of the body. So what's going to happen is the blood is going to pool in the hind legs and in the abdomen, unable to get back up towards the heart. The other side is, with the swelling of the stomach, it puts pressure on the chest. And so what we end up then is an inability for the dog to be able to breathe well. They can't take a deep breath because of all that pressure on them. So between these two things, they're not getting enough oxygen and they're not getting enough blood flow back to the heart. They go into shock, and that is what causes death. So when they first start torsing and that thing is swelling, from that moment to death could be an hour or maybe two. Okay, so it's very rapid disease. It's not something that takes hours to develop. It comes on very quickly and can kill very quickly. So what we're looking for with this is a swelling. The other thing you'll see in turn clinically is that they'll be trying to vomit but nothing coming up. So they're just retching, it's dry heaving, and they're trying to get things out. They may be drooling because the saliva, of course, isn't going down, it's just overflowing. So they're trying to do that. They're breathing fairly shallowly because they can't take a deep breath like that. So they're just sort of small pants almost. And also their back end is getting weaker and weaker. And if you look at their gum color, this is one of the big keys. Lift the lip, look at the gum color. You'll see that it's, rather than pink, it's getting whiter, or it's sometimes even grayer because it's not getting the oxygen in the bloodstream anymore. So those are the things that you'll see, and then finally they'll go down. And that is, they'll be lying down, they're too weak to stand anymore. The heart rate is up, and yet the blood pressure is way down. So these guys are in big trouble. And generally, the way I always talked about it is if they can come into the hospital under their own steam, as when they're still walking, usually they've got a far better chance than if they were carried in. But the chances of that are better than 50%. With the monitoring and stuff that we have at emergency hospitals these days, death rates at that point are down to about 15%, so 85% of them can make it through. As soon as you start having to carry them in and they're in that bad a shape, then we're in trouble. And that's when the chances of survival just plummets. Okay. Now there's two big reasons why we run into trouble with these from a veterinarian perspective. One is that as that twists, part of the stomach wall may have lost its blood supply, so you actually get an area of the stomach wall that dies, and so you've got to cut that out, stitch it up, and that increases surgery time, but also tells us, hey, this thing's been compromised for quite a while. But the other thing is, and this is the thing that always surprises people, is that as the stomach twists, the organ that's attached to it, right about here, is something called the pancreas. So as the stomach twists, the pancreas goes along with it, and its blood supply is cut off. So what happens there is that they're not able to sustain their pancreas, and because of that lack of blood supply, the pancreas starts producing toxins. Now, if they stayed there, we'd be fine. But what happens is we turn the stomach back during surgery, and the blood supply of the pancreas is reinitiated, so all of a sudden the blood's going through, and the problem is it also takes out the toxins from the pancreas and it sends them out into the bloodstream. And there's one very important toxin that is just a horrible problem here, and that is it's called MDF, myocardial depressant factor. So what happens with that is that it's called myocardial as in heart muscle, and it depresses it. So what happens is the heart can be going along just fine, these toxins hit the heart, and it can just stop it cold. Usually we see some regular beats, we see that happening, but you can have a totally successful surgery, as in we make an incision, we go in, turn the stomach back to where it should be, and we decompress it, we get all the air out, the stomach wall can be healthy, and everything can be just looking great, and we stitch it up and say, okay, success. And an hour later, or 24 hours later, the dog dies from heart complications. And unfortunately that does occur, and there's no big safeguard to stop this from happening. Okay, so the main thing is when we have this thing developing, we need to get on it right away. Okay, now this is something you can do at home. If you start seeing the symptoms, and that is you have a dog that's trying to vomit, it's getting weak, its belly is expanding, don't take time. This is something, as soon as you recognize it, you've got to get working on it, which means get to the hospital. So if you've got an emergency hospital that's open 24 hours a day, get there real quick, okay, and give them a chance to try to pull the dog through. If you're hours away from a vet hospital, that's where you may have to do some home care yourself. And this is something that you can learn how to do, and that is tubing your dog. And what I mean by that is you're going to use a piece of say 6-foot long tubing and 1/2 inch diameter. You can use garden hose, or you can actually have a tube that you've bought for this purpose with nice smooth edges on it. And what you're going to do is put something in the mouth to allow you to put the tube in without it being more or less chomped on. And so you can put a roll of tape or something in the mouth and then tie the muzzle shut so that stays there, and then put the tube through the hole. What I've done in emergencies is I just put a towel in the mouth and just lay it over the bottom jaw, and then put the tube over the towel and send it back. Now technically you're supposed to lubricate it, but there's lots of saliva in there, so what you can do is just push it in and you just keep advancing it until you get down to the stomach. Of course, there's a lot more involved than that, but the key is you should learn how to do this, and you can get on the internet and look on how to tube a dog during bloat, or you can ask your veterinarian on how to do this. And the thing is, once you get the tube down and you literally pop into the stomach, it releases the air and it gives you some time. It's not going to solve it. It doesn't do that. But what it does do, it gives you time, so the stomach's down, then you pull the tube out, and then you get to the hospital real fast. Okay, so that's the key. If you identify this disease, work on it right now. Don't hum and haw. You've got to get to work. So the big question is, what can we do to prevent this? So first off, the breeds that are in a big risk for this disease, think of Great Danes, Weimaraners, Irish Setters, German Shepherds, Standard Poodles, Bassets. I know, kind of a different one, but I've seen it a few times in Bassets. But the key is, the ones that are at the highest risk are your giant breeds that are deep-chested. So think of Great Danes, Russian Wolfhounds, that type of dog, Borzois. Those are the ones at risk for having a bloat incident. Okay. Now, also the ones that are truly at risk are the ones that have had, as we call it, first-degree relatives that have suffered from bloat. So in other words, let's say you've got a Great Dane, and its mother suffered from bloat, or maybe its brother suffered from the same disease. Your dog's at risk. Okay, so definitely pay lots of attention and make sure you've got good supervision and you know what to look for. The other thing you might want to do in that circumstance is to do what's called preventive gastropexy. Now what that means, gastropexy means fixing the stomach to something. And what you do in that surgery is you fix the side of the stomach to the abdominal wall. And so that prevents it from doing a torsion. It doesn't prevent it from bloating, and that's okay. I mean, bloat, all you got to do is burp, and that gets rid of the air. But what it does do is prevents it from turning so it doesn't get cut off and you don't end up with this disease. That can be done while they're under anesthetic when they're getting spayed or neutered for the girls and the boys. The only problem with that, of course, is that the incision for being neutered or spayed is below the belt, and for this, it's up here. And so it's a separate surgery almost completely. The other way that's being done nowadays is doing a laparoscopic gastropexy. So they just make a couple of little holes, go in with the tubes, and they can actually fix that to the body wall. Nice procedure. The big question, of course, is which dog should be done, and which, is it cost effective? And unfortunately, it's like insurance. You'll never know, okay? But if you're really worried about this disease, and let's say you've got a dog and it's got two siblings that have died from this, I'd sure be thinking about a gastropexy in your dog if that was the case. In the other ones, we don't know. So what are the other things that we can do? So the big things that come into it is around feeding time, exercise, things like that. So number one, if you're feeding one meal a day, there's an increased chance of having a bloat incident. So we should be feeding smaller meals more often. That could be 2 or 3, even 4, but definitely there's a higher incidence if you're only feeding once a day to one of these dogs. If the food contains soybean meal, there's a 4 times incidence of bloat occurring compared to foods that don't contain soybean. So that certainly has been pinned down as being a contributor to bloat as well. Bloat occurs as they get older, and certainly is something to look at in their later years. There's one that I had just recently. It was a Great Dane that came in, and unfortunately that one was like 10 years old. It had torsed, and it was still early. I mean, that dog walked in and says, "Hey, we can do this," but he had other health issues. And so the owners decided at that point that no, we're going to quit on this one. In contrast, there's one that I saw that was a Doberman, and he was only about 3 years old, and he ended up getting a torsion. And that guy came in horrible shape, and the owners did want to go ahead, but unfortunately the heart problem came up, and even we didn't get to even finish surgery on that one. It was a case of the heart, as soon as something was touched more or less and blood flow went through the pancreas, it stopped the heart. And those are the ones that really get to us, and that is, gee, things were going so good, but high energy foods containing a lot of carbohydrates have not been found to be a risk factor in bloat. And as well, temperament of dog really plays a role here. Calm dogs have less bloat incidence than dogs that are high energy, that are always moving all the time. So you can think about that as, well, if they're bouncing up and down, there's a greater chance of the stomach twisting. I don't know if that really plays a role there, or is it because if they're high energy and more stressed, then maybe the acid in the stomach is causing more problems, so that contributes to a stomach problem, so they swallow air, etc. We don't know, okay, but there certainly is a link in temperament, and that is the calmer dogs have less bloat. As well, having gastrointestinal disorders, inflammatory bowel disease or something like that, increases the risk of bloat. So there's a tie-in there, but it's really hard to say. The big one, and the one that I hear of all the time, is food bowls. And that is, should we put them up or should we put them down? When I went through school, there was a landmark study that came out saying, hey, if you put the food bowls up, you elevate them, that reduces the risk of having a bloat. So everyone moved to doing that. And then a study came out in, well, about 2000 or so, and that one told us that no, having the food bowl on the floor is better because having it up on an elevated platform seems to increase the risk of bloat. What this tells me is that having the food bowl up or down doesn't really seem to make much difference. I think it really depends on what the dog wants and what you want to do. But in terms of bloat incidence, the jury's out. Then that is, we have studies that say you should elevate it and other ones say you shouldn't. It depends which one you believe. And because we have the two ends, I think it's somewhere in the middle. I don't think it matters. The other thing is exercise. And that is exercise right after a meal or before a meal. Does that have an impact? And in a study in 2006, it more or less said no, it doesn't seem to have any impact in that way. But from the human perspective, if you have a meal and then you go for exercise, quite often you're going to get some intestinal issues or stomach cramps or something like that. So from that perspective, I think it makes sense just not to exercise a dog after a heavy meal. So anyway, the key with this disease, and please keep this in mind, if you have a dog that is a large dog, but especially a giant breed, because they're at a higher risk than the large ones, but any of those dogs, if you are worried about having a bloat with the torsion, try and make sure that you know exactly what the symptoms are and you've got a game plan in place for what to do if it occurs. Okay? And then the other things that you do, don't make a lot of impact except maybe having that gastropexy surgery done if your dog is high risk, and that's something to consider if that's the circumstance. So otherwise, watch your dogs, keep them healthy, and watch for more topics for the ACE Academy for Canine Educators.